I think there's no doubt that in general biomarker testing is going to evolve and become more and more complex. We are going to have to investigate more biomarkers in an individual patient's tumour. The investigation of multiple biomarkers poses us many challenges. We have to develop multiplex testing strategies in order to be able to test multiple biomarkers on the same tissue sample. Now, this may be possible to a certain extent using multiplex techniques like next generation sequencing, for example, but certain types of biomarker, particularly those that are based upon protein, are not accessible using this technology. So we're still going to have to use multiple technologies. Now, there's been a great deal of enthusiasm about the so-called liquid biopsy. This primarily has involved the use of circulating free DNA as a source of DNA for molecular testing. This comes with a number of challenges, notwithstanding the technical issues around the handling of a blood sample, the sensitivity of the tests and their ability to detect a mutation at a very, very low level when it's diluted by much DNA that's not derived from the tumour. And of course, if we find a mutation, we actually don't know where it came from. We assume it's come from the patient's tumour, but that is an assumption. However, there are definitely clinical signs that particularly in specific areas where a targeted mutation may be sought, in other words, you know what you're looking for, you go look for it, you can find the mutation, and then that can inform a clinical decision, and treatment using such clinical information clearly has benefits for patients. So I'm sure that plasma-based testing will become part of the portfolio of testing that we will have in the future.